holistic view of healthcare. So healthcare is not about sick care anymore. It is about taking care of our health, starting from our lives at home, and also when we are doing business, or when we are having fun, or when we are out, everywhere it starts. And then, of course, we need to make sure that we prevent diseases to happen. Eventually, if we have to go to hospital, of course, we need to provide the best diagnostics and best treatment. And after discharge, we also need to connect our patients to their healthcare provider. Because if we are not connected, if we are not coaching them, if we are not guiding them with better health conditions, then readmissions will increase, and that will also increase our costs in the healthcare system. So we want to avoid higher costs, but we want to also improve the outcomes. And we believe in Philips, we can only achieve that to have a holistic and broader view across the health continuum. So healthcare doesn't happen only in hospitals, it happens everywhere. It starts with us at the home, and it ends with us at the home. So in between and from beginning till the end, Philips is there with unique capabilities to help healthcare providers, to help the governments and society. Some numbers, maybe some facts, how Philips is making a difference in health tech. More than 275 million patients are tracked with Philips patient monitors in the world. If you look at home monitoring, Philips is also very much engaged in home monitoring solutions. More than 1 million people at home, they are monitored with Philips connectivity, with Philips solutions. 18 petabytes of imaging study data managed for healthcare providers. So you see a lot of proof points how Philips is making a difference across health continuum in health tech space. I would like to give you some examples, some living examples of these different differentiating points. So one of the unique proposition Philips is providing globally as well as in our region is the proposition we called as eICU. This is about connecting the ICU beds to the remote center, and by doing that, we support the bedside ICU teams and standardize high quality care. So when we have this executed, we have some independent studies as well. We saw that we are preventing deaths by 26%. So people are 26% likely to survive within this system, as well as 15% higher chance of faster discharge. So it is increasing outcomes, so better outcomes, as well as lower costs. And I'm very happy that this is not only happening in America, it is also happening here in our region. We launched this unique proposition in UAE, in Last Arab Health, and we are collaborating with MOH in UAE in order to expand this solution in UAE. And many other customers of Philips would like to collaborate with us in order to implement this solution. So this is a unique proposition Philips is engaged with, and we really believe that this is a very important problem solver for the region, because we have a lot of infrastructure issues, we have a lot of lack of educated, trained personnel. I think I'm going very much in detail. I'm passionate about this, but my team will be talking about this in detail. We'll give you more details about this, because I believe this is a great solution for the region. Another example I would like to give you, so we know by fact that 40% of the deaths in hospitals are happening on the general ward. This is a big number, and we can also solve this problem with our Guardian solution. Again, I'm not going to talk about it, So we will go into the details of this solution, but this is a very important, again, solution that we can implement in our region. And we have a number of projects ongoing in Middle East. Another proof point I would like to talk about is related with image-guided therapy. As you know, number one reason of death in the world is cardiovascular diseases. And Philips in the world is a world leader in cath lab, so outright leader. Last year we acquired Volcano company in order to go into, in order to extend our capabilities in minimally invasive therapies. So we are really expanding in this area, and we believe this will create additional unique propositions for our region as well, because we have a lot of issues related with cardiovascular diseases, and as a result of lifestyle changes and obesity, chronic diseases, we believe this unique capability will be very, very helpful for the region. Another important proof point is related with diagnostics. Philips is able to offer one unique platform to bring different scans coming from different devices into one proposition, which we call IntelliSpace Portal, and is able to provide advanced visualization to the clinicians. By doing that, we believe we are able to provide first-time right diagnostics. Of course, first-time right diagnostics will give us better treatment and more faster treatment, and hence improved outcomes. Let me go back to challenges, but not worldwide challenges, but our regional challenges. So what are our regional challenges in this in Middle East? Growing healthcare spending, and this is as a result of increasing population. Our population is fastly increasing in the region, as well as infrastructure, lack of infrastructure. So we see a lot of investments and a lot of increase in population. This is resulting with increased costs. Lifestyle-related diseases, again, because of eating habits or because of lack of sport, we see a lot of chronic diseases increasing in our region much faster than in the world. Lack of human capital, lack of educated personnel and physicians and healthcare personnel. This is also threatening our healthcare ability in the region. Excess of quality care, because of lack of infrastructure or people, we also see less access for many other people, because increasing population require more hospitals or more healthcare providers. We need to cope with these challenges. And also on the policies, regulations, we see that they are not at the world standards yet. So in order to help these challenges or mitigate these challenges, Philips is here to help. And I would like to give you now some of the proof points that we have in the region. What are we doing? How we are helping our customers, and how we are helping the institutions and partnering with them to find some effective solutions to healthcare challenges in the regions. Qatar is, so I would like to talk a little bit Qatar. Qatar is one of the fastest growing countries in the region with a lot of need in healthcare system. Of course, you can open hospitals, but it is not enough. So you need to be strategic in what you are doing in the healthcare, in the system. So in order to help Qatar government, we are collaborating with many institutions, with Ministry of Health in Qatar, to develop special programs and to help them to develop effective healthcare programs. My team will talk about the details, but for example, one of them is related with Treatment Abroad project, which will be discussed in detail. It is a very important project that we believe not only in Qatar, but also in the rest of the region is a valid concern. And we are helping Qatar government with this problem. And I believe we can also help the rest of the countries. We have the experience and capable teams to reach this objective. Another good example is in UAE with Burjil Hospital. We are collaborating with them, and this is the first Philips Center of Excellence in the region. We are collaborating on many aspects, but especially I would like to talk about education. As a result of our MR Technologies program, for example, we were able to improve the outcomes, and we were able to drive the costs down. We were also able to increase staff satisfaction, people satisfaction, hence better also patient satisfaction. We are extremely proud of this practice in UAE, and we would like to extend to the rest of the region. In the region, we need a lot of new hospitals as well. And in order to achieve that, we are very much engaged also with greenfield projects. And it is not only about equipment, it is not only about technology, but it starts even from the design phase where Philips can be involved. And we are involved in one of the important projects that I am not able to give you the name, but it is very important that we are now involved in from the design phase till the medical planning, technology planning, education, and on a big-term partnership, so on a long-term partnership, not only just selling and getting out, but engaging in the partnership across the continuum and across the years. So we are sharing the responsibility of bringing healthcare to the community, together with our partner being involved in a large-scale project. We are able to deliver large-scale projects in the region, and we have different models that we can offer to different needs of different countries. Another good example, because in our region one of the increasing concern is cancer, especially amongst women, and we know that awareness is playing a very important role to cope with this big problem. And in order to help the society, again, Philips has been involved in campaigns, marketing campaigns, programs, education programs since 2012 in different ways. One of them is our collaboration with Zayed University, where we were able to lecture for 1,000 women, and this was also registered in Guinness records. So we are, again, very much capable of creating awareness in the prevention stage so that people do not get sick and go to hospital. Of course, when they are in the hospital, we are here to help people, but primarily we don't want anyone to get sick. So we have capabilities to help them not to get sick, and this is a good proof point. I think this is end of my speech, end of my presentation. I'm glad that we had the chance, and I hope tonight will be very fruitful, and I hope you will have a good time and you will have good learnings from this session. I wish everyone good health and happy 2016. Thank you very much.
Assalamu alaikum. So, good evening again from my side. My name is Karim Al-Laythi, and I am responsible for the clinical marketing for magnetic resonance and computed tomography covering Middle East and Africa and some part of Central Eastern Europe. Very excited about being here. Thanks for having us with you. And following the presentation from Özlem, she was talking about the challenges in the region and in healthcare. I would like to have a very short overview with you about the challenges that we have in diagnostic imaging. And we will touch base about on these challenges from an MR and CT perspective, how the Philips innovations were able to overcome these challenges. So let's start with MR. So our first part is about the Ingenia. It's our MR platform. We call it the digital broadband MR technology. This is still the world's only and still the first broadband digital MR technology. What does this mean? This means that Philips were able to change the entire acquisition technology when it comes to MR signals. We have changed the analog pathway of acquisition from 1.5 meters and 2 meters into 2 centimeters. What does this add to you? What does this mean to you? This means that we are taking the image quality from this standard to this standard. This adds 40% signal-to-noise ratio to each and every acquisition and examination you are making in the MR room. So you have 40% added signal-to-noise ratio. This adds a lot of image quality to your daily work. This adds to your clinical confidence and your entire clinical outcome. Moreover, since we are able to get more signal and more information out of the patient, we are the only vendor in the market that can offer you an extended field of view in a standard big bore 70 centimeter systems. So within a 70 centimeter bore systems, we offer you 55 centimeters in X and Y and 50 centimeters in the Z plane. This is an enlarged extended field of view, fully functional for all anatomies, all sequences at no compromise. Again, this is purely and merely based on the digital technology. So this one, the first challenge in MRI. So the signal acquisition and patient time table. So the usual patient time table in any MR room is about 20 minutes. With this digital technology, we have reduced this to 8 minutes patient table time. So instead of 20 minutes, there are 8 minutes patient table time. The second problem when it comes to the patient table time and the acquisition, examinations are repeated, scans are repeated, the patient is incooperative, friends are afraid to come in, and so on and so on. If I can tell you that we can change the MR setup room from this one that increases the level of anxiety and concerns of any patient comes to the room to have something like this. This is a real installation. This is not a marketing image. This is a real installation from our installation in Karolinska in Sweden. It's actually a long-term deal with the hospital and group there. It's a 20 years agreement of delivering diagnostic imaging systems, and this is just part of it. So this is part of what we call the ambient experience in the MR examination rooms. So let me invest 1 minute more on this. So it's not just about how the room looks like. Actually, we have 3 main pillars. One of them is the visual immersive experience. This means that using a mirror on the patient head and a video screen at the back, the patient focus and attention is completely taken out of the bore experience. So this means that you have a more relaxed patient, more calm patient, and you can change the themes from one patient to the second. And again, this is not the whole story. So we have the immersed visual experience, we have the auto-voice, automated instructions in 31 languages, and even editable messages tell the patient what to do, the table is moving, you can breathe normally, you should hold your breath, and so on and so on and so on. Automizes the entire workflow of your examination. Third point, and it's maybe again very, very important, which is the comfort tone. Again, it's a challenge in MR studies today, it's the noise pressure. So with the Philips innovation here, the comfort tone feature, we can suppress 80% of the noise pressure in the bore experience. This means that in all your anatomies, all your procedures, all your sequences, you can reduce your noise pressure up to 80%. No other vendor can promise you this. And just to sum up at this point, this is the result of a study has been done in Denmark about how many exams have been repeated in a different MRI setups and different MRI examination rooms. So from 7 examinations, only the one with the Ingenia, with the ambient experience, has the lowest repetition rate of examination. So this is not just fancy lighting technology. There's a lot of science in here, and it's the result of a decade of research collaborated between Philips Healthcare and Philips Lighting. So with this, I want to move to the CT part. So again, Philips has achieved to overcome a couple of the main challenges in CT imaging. And I would like to brief you about our Icon Spectral. I will start with something which is actually the core technology in delivering spectral technology, which is the IMR. So basically, in CT, it's known with any standard reconstruction that you should choose either low noise, low resolution, a high resolution, or low dose. You cannot combine any of these. With the advances in iterative reconstructions, all vendors, including Philips, of course, were able to make the life a little bit easier. So you can combine at least two of them. So you can get a little bit higher resolution with a bit lower noise or lower dose. The ultimate of this, the holy grail of all this story, if you can combine these. So we are very proudly, confidently telling you that with the IMR, which stands for iterative model-based reconstruction, you can reach this image quality, which is virtually noise-free at the lowest possible dose and at the highest spatial resolution. How can be this done? This is a very sophisticated algorithm. It models the noise in the X-ray beam. It models the scatter in the body, and it models even the tissue-to-tissue interactions. So with IMR, just keep these figures in mind. So you have 80% reduction in dose, you have 80% improved in low contrast detectability, and you have 80% lower noise. And this takes your images from this, the standard filter back projection, into this, and again here. I mean, the numbers here are a little bit small, but even here, the dose levels are stated, so we have sub-millisievert in both studies. So, and last example from IMR, this is actually a 3 Tesla MRI image, okay? And if we can tell you that we can get the CT image quality up to the MR level when it comes to low contrast, so you can get this CT images. This is the CT images reconstructed with IMR, again compared to the low contrast detectability of MR acquisitions. So this feature is available almost in all our portfolio, with the exception of the 16 slice segment, but you can have it all. And proudly, again, I would very briefly talk about our ICON. So ICON is our spectral machine. It's a detector-based spectral system. This means that we have a double-layer detector that's able to acquire the entire energy spectrum of the X-ray incident and arrives at the detector. So low energy, high energy, both combined, we have the entire spectrum of X-ray. With this available in each and every acquisition, you can reconstruct your entire data set having one of these 4 flavors or all of them. This means that you can reconstruct your entire data set at any monochromatic KEV between 40 and 200, as if you have rescanned your patient at single energy X-ray. And you can get what we call the water-only images, like tissue-only images or iodine-only images. And above all, you can get this one, colored one here. This is an overlay according to the effective atomic number. So usually the CT images are density-based. We can overlay images according to their atomic, effective atomic number. So you have two kind of information, the density-based information and the atomic number-based information. It adds like spectroscopy in CT. So having this always, so you can get it on demand. You don't need to plan this prospectively. You don't need to rescan your patient or to repeat your examination. This is just an example. This is a renal failure case. The physicians have allowed only 20 cc of contrast media. Anybody knows this is not sufficient to make a real diagnostic scan, and this is the exact result. So having this data set, sending this to the spectral reconstructor and get a monochromatic reconstruction, you can get this result out of it. Again, no rescan. The patient is home, safe, no X-ray more, and you got this only from your data set you have. Again, this is only possible if you have the technology enabling and facilitating getting more information from the beams you have already